Okay, welcome to your ImageTrend training. This is going to focus primarily on suppression units. So we're going to walk through how to set up your crew, your unit and shift, and your medical device, and how to complete a run form. Here on the left-hand side, you can see where it says crew. You can add and remove crew members here. So you can see right here, this would be what you would select for the captain. So you would search in your crew member for the captain today. You would select it. Their level of care they can provide will automatically integrate from your roster. And then you're going to select their role. So if it was not selected here, you would want to choose other patient caregiver at scene and so forth. And you can see we're going to go right into the engineer. So for engineer on a suppression unit, you're just going to select driver/pilot response, other patient caregiver at scene. And then for the firefighter paramedic, that is going to be responsible for patient care, you will select primary patient caregiver at scene only. For the fourth man, you're going to select their name, and then their role is just going to be other patient caregiver at scene. So just to recap, all of the crew members will have other patient caregiver at scene, except for the firefighter paramedic that is responsible for the patient care and running the calls. The engineer will just have an addition to that, which will be driver/pilot response. For the unit and shift, you're going to add in your apparatus, the call sign you're going to be operating under. It should automatically transition over to your primary role of this unit, and then for the level of care provided per protocol. Medical device, you're going to select whichever medical device you have on your apparatus. If you change or use a reserve monitor, you're just going to have to reflect which medical device that is. However, your unit and shift and medical device should not change for your iPad that you have within the apparatus. It should always be matching up. If not, that's how you're going to input the information again. On the bottom hand portion of the run form here, you're going to have your inbox, settings, logout. On the far right, you can see views, and those are just different views. You can have your runs on the calls that you've completed or started appear on your dashboard here. For new CAD incident, you're going to select this when you are all set and you're ready to run a call. As you can see right here, it's going to always show incidences that have been generated in the CAD and have transferred over into the download CAD incident list here. If, say, you have a short ETA and you do not able to find your incident here, it should be at the very top here, but say if you have a very short ETA here, then you can just select New Incident at the bottom. After selecting this, you can go ahead and start filling in as much information as you can. The only thing that you get from your CAD is just going to be the run number and the times for that apparatus. So as you're going through, you can start to pre-fill a lot of these values here. You can select this number of patients here from your CAD notes, and then you can start filling out the patient information. But let's say that on the way to transporting, or on the way to responding to the call here, your CAD incident finally displays here. So you can select at the very top under CAD, and you can search the one that you are trying to download here. And for this one, let's just say that we are going to utilize this run right here. I'm going to adjust these times. So that way this run will make sense. So let's say we arrived on scene at 17:02, 10 seconds. Say we had a call just across the street here. So as you're going in, you're going to select single number of patients. You're going to select when you arrived at the patient. So you can either select this clock symbol here, which timestamps it for the current time, or you can backtrack it to when you did make contact if it, for whatever reason, you weren't able to fill that field out. However, for the purpose of this call, you want to make sure that you timestamp this very accurately and as you make patient contact to allow very fast input of data through your run form so you're not having to be backed up on paperwork in the call. As you're moving down, this is the one pager here that's required for you to transfer the call out to the transporting unit. You can utilize this scan driver's license barcode here, and you can select the patient's name, or you can scan it, or you can manually input it like you just saw right now. If, for whatever reason, you're not able to do that, you can select the date of birth there, or you can use the date of birth tool here and rapidly input a date of birth. You can utilize whatever you feel most comfortable doing. You can then select the race for whichever one applies. And then once it gets to this unit's disposition here, this is where you're going to use the preset values. The weight is not highlighted yet, but we're going to pre-fill that in. And remember, get everything filled out on this that applies as much as you can. But once you get to this unit's disposition, that's where you're going to take over and you're going to select one of these preset value dispositions. For most of your calls, it's going to be transfer care to transporting unit, which would be your second preset value you can select here. If you're writing in with the transporting unit, then you would select write in with transporting unit. So if you're transferring care to a transporting unit, you would select this one here, and you can see every time you select one of these preset values, it shows you the new value that you're going to replace with the current value. So you can see everything is blank under current value, and we're going to reset it to this new value here. Now let's say throughout the call you want to write in with the transporting unit. You can always come back to this page and select write in with transporting unit. And you can see right here what's highlighted in a tan color is what is getting changed. If nothing is from the current value to new value, if nothing's getting changed, it's just going to remain the same. So it'll always keep overwriting if you need to change it up, or if it goes into an AMA, you can select that and it will overwrite everything that you've done. However, as you come down into here, you can see transferred level of care primary care 2 is what you're going to select because you have an ALS or BLS unit sometimes available. So we're going to say this is going to an ALS unit. And for this one, you're going to select transport by another EMS unit or transport by another EMS unit with a member of this crew if you're writing in with the ambulance. So we're just going to say that this is your average call. You're transferring the care to another ambulance transporting unit. So we're going to select transport by another EMS unit. As you come into the chief complaint, this is where you can select chief complaint. And we can just say that the patient's having abdominal pain. It's going on 10 minutes now. And that's all we have. We can say that this is not a major trauma. It's a mild status patient. And we can select the provider's primary impression, as that will be different to what the chief complaint is in some cases. We have to select these closed call rules, whether it's a cardiac arrest, possible stroke, possible STEMI. And then from here, you're going to select the transporting unit. So let's say that's a Chula Vista unit being transported, and we're going to transport this to Chula Vista Medic 57. You're going to timestamp when the transfer occurred. So let's say that it happened 1 minute into the call. Box showed up about a minute or two after, and then you got a brief chief complaint, and you got this done at this time, and you relinquished care to them, and you got off scene. You can select no base hospital contact if you did not make base hospital contact. However, if you did make contact, you can input UCSD and select the time that you did it at. And you can say, hey, this happened 40 seconds into the call, a minute into the call, 5 minutes into the call. Does not matter. You can select whichever one applies. And again, if you didn't make contact, you can put no base hospital contact made. And then the box will have that on their run form once you transfer it over. A few more things that you have to do here is just getting a set of vitals inputted in here. So to get vitals, you can either upload your monitor data and download it, and then that will live with under the assess/intervention underneath assessment. So you can download it and it will appear in here, or you can go into your timeline and it will appear there as well. But you can see as we fill this out, we're going to go ahead and utilize the power tools on the right-hand side that are highlighted in blue. Normally on a call, you're going to have a GCS that's being done immediately. And so we can say, hey, right at patient contact, we knew that the patient was alert. They were 4, 5, 6 for a total of 15 GCS, and they're totally acting appropriately. So we can input this vital sign, and you can see right here, it's still going to highlight red. And then we're going to go into a vital signs whenever that becomes available. Let's say we get a OP or we get a GCS, and then we're going to go into an OP QRST. So we can go in and get a pain scale, and we can say that they're complaining of 1 out of 10 pain here. And it's on palpation. It's a uh, sharp pain here, and it's on the epigastric region. It's non-radiating, and like we said, is going on 10 minutes here. So we can select that. You're going to select the time that it was done at, and we can say, hey, this got done that much time into the call. And you can see it's still red here. And then all we have to do is get the first set of vitals. So if you want to rapidly input this from your monitor, once it comes up, you can hit it, and this time should be live, so you're not going to have to adjust this time too much, but just to make this call make sense, we're going to say that, hey, this is when we got our first set of vitals. And then as it starts appearing here, we can select, hey, 120, and then that's going to go into the systolic to diastolic here, and it just keeps going down, so you can rapidly input this onto the monitor. And so we can say this was a cuffed automated blood pressure, normal pulse quality, normal respiration effort. We can hit airway was normal, it was normal sinus, manually interpretate it, and then you can put, hey, they're saturating 99% and put in a temperature if you are able to get it. However, you do not have to get a temperature. It is not required. You can see once I do input it, I have to fulfill the values. But let's just leave this blank, and you can see it's not something you have to have done. Just make sure that you put in the pulse oximetry qualifier, and this is all you have to have for a first set of vitals. And you can see once I do that, it takes away all of your vitals. If you do get a blood glucose, I recommend doing the BGL, the blood glucose power tool here, because it allows you to do the procedural code along with the vital sign. So we can say at patient arrival, again, at this time, we got a blood glucose level of, say, 120. And now you can see all the vital signs that you have done are there. You can look on the timeline, and you can start seeing it's starting to make a picture of what's going on scene here. So once you have all of that, you have enough to transfer the call over to the transporting ambulance or agency, and then you are all done. If you are doing a PCR to another agency, then you have to complete the rest of the PCR, which we're about to go over. However, if you are just using what you have here and your agency doesn't require you to make a duplicate PCR or run form, you can just stop right here. And that is all you have to do, and the ambulance service will be completing the rest of the run. However, if you're from another agency or transferring it to another agency, then you have to complete the rest of the PCR and get it to 100%. Another case would be if you are within the same agency, but you give a narcotic on scene. You have to complete a full PCR because you have to input your seal number, your lot number, and have your crew member signature within your run form. If you do something pretty invasive like intubate or start giving a bunch of medications, then you're going to have to transfer and keep. So how to transfer would be up here, and you'd hit transfer, upload transfer, and select the agency. You would select the unit, and then you would hit no transfer and keep, or if you're just doing your average call, where you just got a chief complaint and a first set of vitals, you'd hit yes, transfer, and remove. So for this instance, let's just say that we gave medication, started an IV, and we gave some fentanyl. So for this, you'd have to complete the rest of your PCR. You can still transfer it and keep, and the box can get transporting. After that, you can then come into here and complete your PCR now, and you can say, hey, we responded to this call, lights and sirens. It came out as abdominal pain. We were first on scene. For the response information, we're going to say that this was done at a private residence. And for the patient's history, allergies, meds, you have to put whether they're homeless or not, and then if you scan their driver's license, their address will come in. However, if it does not, and you're at a different incident location, or the incident location is their address, and that address on the driver's license is wrong, you can always select this, and it will import the incident address from the CAD. For the history here, you can input if they have a medical history. For a simple one here, let's just say that they have hypertension. That's all that they have wrong. They have no allergies. However, just know that you can also select not applicable, not listed, and you can free write all the allergies that you want here if it's not listed in the common word bank. Same thing goes for medications. You can choose what medication they're on. You can select if they're on lisinopril, but if it's not listed again, you can hit that not applicable, not listed, and then you can start typing in what medication that they take. And also know that if you select on a current value too, you can select the dosage. So we can say, hey, they take 10 milligrams of this dose, right? And they take it orally. So oral, and you can do that. You can be as detailed as you want, but again, not a required validation field. I would only recommend doing this on Eliquis or blood thinners, so we can say, hey, they take 5 milligrams of this, and that's more important for your legitimate active stroke patients, so the hospital can determine if they're a candidate for TPA or stroke therapy, if they can administer that right away, or if they're not going to be a candidate and is contraindicated. And so into here, we're going to go into assessment here, and you can go into protocols used and select abdominal pain. Just know you can use this hyperlink here. It takes you straight to the county's website onto the active protocols. And so what that does is it brings you to this center here, and you can search all the current protocols. Not that we don't know our protocols. However, I find this very useful for your pediatric resuscitation tape and your drug dose chart. So if you did have a pediatric, you can come into pediatric protocols. You can go into the length-based resuscitation tape at the top here, and then you can go into the ALS pediatric drug chart. So for this, it gives you all of your medications for every single different color category. You can come to your color category, and then you can have your medications that you give right then and there, and your defib and cardioversion settings as well. Gives you everything you need to know about the pediatric, so that way you can flip back and forth between the tabs or have the captain do that. Just a tool you can use if you want to. For primary symptom, we can just say pain and go into, hey, they're having pain in the epigastric region. There's no barriers to this patient. None reported. It's not a work-related injury. And then we can put our assessment tool. So right here, it even says use assessment power tool for secondary assessment. So you're going to collect this assessment with the person symbol on the right-hand side. And then you're going to select whether it was done prior to arrival. And for you, it's going to be done. It's not going to be done prior to arrival. And then there's a couple ways you can get this selected. So you can either select tags normal and manually select these, or you can hit all normal and you can then unselect, say, the abdomen. Or you can just go into the abdomen and go to generalize and unselect normal. And you can just say, hey, they're just having pain here. And that's all they're having. If there's other things going on in the abdomen, you can hit location. And then you can come into here and select another region and say, hey, they're also having pain here. You come back and you can see as it starts highlighting green, you're selecting that something's abnormal there, and it's going to reflect upon your run form. Say this is all that we needed to do. We can hit OK, and then that fulfills that validation there. We can say that the final patient acuity status is a mild patient. And then under here, you can generate your narrative, and you can hit generate, and it will then see right there and put everything you've done. However, let's say that we weren't done with treatment, and we were continuing to treat before we finished our narrative. So let's say on this call, hey, we started a 18 gauge IV, and then we also gave 100 micrograms of fentanyl. This is again where we can backtrack this if you were doing this after the call and hit a patient arrival. And 1 minute in, we started at 18 gauge left AC, and then that fentanyl, we gave it right after. So we can go, hey, a minute in, we gave it right after, and the patient improved, right? And you can add a medication comment here and say, hey, went from 10 out of 10 pain to 4 out of 10 pain. You can hit OK. Interventions. For that, and that's what we have. So for this, we're going to make this time a little bit better. Okay, so right there, you can see on the timeline, we assessed, we started an IV here. I'll readjust this time. Makes sense, but right there, we started an IV, gave a medication through the IV, and then we transferred care to the transporting ambulance. So once you input those, you can then select that, and you can see right there, it shows under treatment, hey, we inserted an 18 gauge fentanyl, 100 micrograms given through the IV, transported to the, or transferred care to this transporting unit right here. You can then come into here and you can input your incident, chief complaint, history, and assessment details. Once you finish that, you can come into your EMS signature and you would just select select the crew member that's responsible for patient care. You can select that you did it at this time. And then this is where you would have to then fill in what medication you gave. So you would come into here, select how much you gave, how much you wasted. You would put in your serial number and you can say, this is the one that we did. Crew initial, and you can say, hey, this was my other crew member that did it, and that will fulfill that. Now you can see you're at a 95, and then you're just going to reload the CAD, and it's going to give you your time that you cleared the call. And I'm just having to remove those crew members since it's another incident that I downloaded. We can see right there, all your times are in there. Your timeline's going to look like this. Underneath your narrative, you'll have that completed out to how you want to. You can save it, and then you're going to post it. If this was the complete incident being done, you would hit mark incident finished on post, and then you would post this to the cloud. This goes into the server, and you can access it through the web version if you have to make adjustments later or add an addendum. Outside of that, like we said, if you wanted to transfer this call, you could hit upload transfer and transfer it to another unit, and that unit will download it on the transporting side. Or if you're transferring it to a squad and you're on the pump or the tiller, then that's what you would do, and they can download it and you can clear off of the scene. However, this is all you would have to do if you were transferring it to another transporting unit, which would be getting, again, this first page done here. A set of vitals, which we showed, looks like this. And then that's all you would have to do. If you did something extra, like give narcotics on scene, did a lot of interventions on scene, like giving medications, IV therapy, all of that, then you would have to fill out the rest of the PCR. However, most of the time it's not going to happen. Most of the time it's just a, hey, what's going on? And this is what the complaint is. Here's a history, allergies, meds, if you're able to obtain it or not. However, all you would have to do is get this first page filled out, and then select the correct disposition, and then you would hit your set of vitals using the power tools, and then transfer it over to the transporting agency with the correct unit number. Once you do that, you're all set. But again, if you had to transfer and keep for one of those reasons, like giving narcotics, or you did some major procedure on scene before that box and you want to justify why you did it and document it, then you would just transfer and keep and document it and post it for your record.